You can start. I can see.
My screen is shared right now.
Yes, it's okay.
Okay, great. So again, ES Atla from University of Tlemcen, where we are presenting the COVID-19 evolution in Europe. Of course, again, the COVID-19 affected every country in the world. That's why it's called a pandemic, a worldwide global health crisis. But for our study, we are focusing mainly on Europe. So what we did is that we tried to compare the cases and the deaths according to worldwide data that backs up from Johns Hopkins University and whose weekly updated data. So we tried to compare between these two parameters, cases and deaths, with the influencing different factors. So, of course, we can see that according to the cases and the new deaths, there are differences between different continents from Africa to Asia to America. Some had higher deaths, some had higher cases, etc. But for our study, we focused on Europe, where we can say that the countries that were least affected by COVID by number of inhabitants are Belarus, Albania, and Bosnia, and at the same time, the countries that were most affected are the Faroe Islands, Cyprus, and Gibraltar. So the first COVID cases in Europe were recorded in France on January 24, 2020, following after that Germany and Finland, and the highest number of cases in a single day was on March 31st, 2022 in Germany, with more than 500,000 cases. And for the deaths, the first COVID-19 deaths in Europe were recorded in France, again in France, on February 15th, 2020, and the highest number of deaths in a single day was on January 20, 2021 in the United Kingdom, with almost 2,000 confirmed deaths. After analyzing the data, we distinguished four types of groups of countries, European countries, with four clusters that we will later show in mustache boxes. In cluster 1, we had 10 countries. The cluster 2, 22 countries. Cluster 3 in green, 7 countries, and cluster 4 we had 9 countries. So for the first cluster, cluster 1, which is represented in red, it represents the country that had the highest number of cases per million, with the highest deaths per million inhabitants. And for the cluster 2, which is represented in orange, it represents the countries that have the highest number of cases with the average number of deaths per million inhabitants. We move to cluster 3 and cluster 4, where cluster 3 is represented with the green color, and it represents the country that have the lowest number of cases with the lowest number of deaths per million inhabitants. And the final cluster, which is cluster 4, which is represented in gray, it represents the countries that have the lowest number of cases per million with the highest number of deaths per million inhabitants. And to conclude, we say that COVID-19 has spared no country in the world, but with different, of course, repercussions. And for the study, we focused on Europe and we distinguished four different groups of countries. A group that was ravaged with the virus with high mortality, a group that was able to limit the circulation of the virus but still had high deaths, another group that had many cases but a lower mortality rate, and of course a final group that had both limited the circulation of the virus while also having a low death rates. And that's it for our study, and I thank you for your attention.
Okay, thanks for your presentation.
Thank you, Professor.
If there are any questions, please ask for this presentation. Okay, close your share screen, please.
Okay, thank you, Professor.
If there anyone else who has to present, Samira Soltani.